If you're living in the United States and you don't have health insurance, this next moment might be one of the most important ones you watch all year. Because the truth is simple. One unexpected emergency room visit can cost you more than $3,000. A simple ambulance ride can cost $1,200, and a hospital stay can wipe out your entire savings in a single night. But there is a way to protect yourself, your family, and your future without paying thousands of dollars every month. And that option is Obamacare. Yet most people still don't understand how it actually works, who qualifies for huge discounts, or how to enroll in the right plan before the deadline shuts the door for the rest of the year. So today, this video is going to break down everything clearly, simply, and in a way that finally makes sense. Whether you're self-employed, a student, a part-time worker, someone who recently lost a job, someone who just wants affordable coverage that won't destroy their budget, this guide is designed to help you make the smartest decision possible. Obamacare, also known as the Affordable Care Act, changed the entire health insurance world in America, but millions of people still don't know what it really offers. Maybe you've heard about subsidies but don't know what they mean, or you've seen plans online but don't understand the difference between bronze, silver, and gold. Maybe you've tried to enroll before and got confused by the forms. Or maybe you're afraid of choosing the wrong plan and getting stuck with high bills. I understand this system can feel complicated, overwhelming, and even intimidating, but it doesn't have to be. By the end of this video, you're going to understand what Obamacare is in simple language, how much you should realistically expect to pay, how to qualify for free or low-cost plans, and how to avoid the biggest mistakes people make each year during enrollment. Open enrollment only happens once a year, and missing it could mean living an entire year without coverage. So take a deep breath, stay with me, and let's walk through this together. Your health, your wallet, and your peace of mind depend on the knowledge you're about to receive. Obamacare, officially known as the Affordable Care Act, is one of the biggest changes ever made to the American healthcare system. Before it existed, millions of people were denied coverage because of pre-existing conditions, charged extremely high prices for basic care, or completely left without insurance after losing a job. Obamacare changed all of that by creating a nationwide marketplace where anyone's students, freelancers, part-time workers, families can shop for health insurance just like they shop for a phone plan. It set rules that companies must follow. They can't deny you, can't charge you more because you're sick, and they must include essential health benefits in every plan. It also introduced financial help, known as subsidies, so that people with low to moderate income can pay much less for monthly premiums. In many cases, people get plans for under $20 a month or even $0. The purpose of Obamacare is simple: make healthcare available, affordable, and fair. No more guessing, no more being rejected, and no more paying huge medical bills with no protection. It created a structure so every American has a real chance at getting proper coverage. And that's why understanding it matters. A lot of people are confused about who can actually sign up for Obamacare, but the truth is, most people in the United States qualify. If you are a U.S. citizen, a green card holder, or a lawfully present immigrant, you can apply directly on HealthCare.gov or your state marketplace. Age doesn't matter whether you're 18 or 60, you can still get a plan as long as you're not currently on Medicare. Income also doesn't disqualify you. In fact, the subsidies were created specifically for people who don't have employer insurance or who earn too little to afford private plans. Self-employed workers, gig workers, part-time employees, students, and unemployed people can all qualify. If you've recently lost insurance from a job, you're eligible too. There are, however, a few exceptions. Undocumented individuals cannot enroll. People who qualify for Medicaid must apply through their state instead of the marketplace. For immigrant families, each person can qualify separately. Even if parents don't qualify, their children who are legal residents still can. The rules are designed so coverage reaches as many people as possible. If you're living in the U.S. legally, chances are you're eligible and you're closer to affordable insurance than you think. One of the strongest parts of Obamacare is the requirement that every single marketplace plan must include a set of essential health benefits. These are not optional, not extras, and not upgrades. They are required by law. Every plan must cover doctor visits for regular checkups and preventive care, so you can handle health issues before they become expensive emergencies. They must cover emergency services, meaning if you end up in the ER, the plan can't skip coverage. Hospitalization is included to whether it's surgery, overnight stays, or treatment after an accident. Mental health services, therapy, and substance use treatment are also mandatory, making mental wellness just as important as physical health. Pregnancy, maternity, and newborn care are required, even if you're not planning to have kids soon. Prescription drugs, lab tests, vaccinations, pediatric services, and rehabilitation services are all part of the package. This means no hidden gaps, no surprise exclusions, and no basic care missing. Before Obamacare, many plans skipped these benefits to appear cheap. Every plan on the marketplace must meet a standard of real coverage. When you shop for Obamacare plans, you'll see 4 main categories: bronze, silver, gold, and platinum. These are not about the quality of care you get the same hospitals and doctors. They represent how costs are split between your monthly premium and what you pay when you visit a doctor. Bronze plans have the lowest monthly premiums, but the highest deductible and out-of-pocket costs. They're great if you rarely go to the doctor and want the cheapest monthly payment. Silver plans are the most popular because they balance costs and quality, and they unlock something powerful: cost-sharing reductions, extra discounts that lower deductibles and co-pays for people with moderate or low income. This means a silver plan can sometimes give you gold-level benefits for a much cheaper price. Gold plans have higher monthly premiums, but much lower deductibles, making them ideal for people who visit doctors frequently or have ongoing health needs. Platinum plans have the highest premiums, but extremely low out-of-pocket costs, suitable for those who want maximum protection. Choosing the right tier depends on your health, budget, and how often you seek medical care. When you understand these categories, picking a plan becomes much easier. Subsidies are the financial help that make Obamacare affordable, and for many people, they are the reason monthly premiums drop from hundreds of dollars to only a few dollars, or even zero. These subsidies are based on your income, household size, and the average cost of insurance in your area. The lower your income, the higher your subsidy. For example, someone earning between $20,000 and $35,000 a year might qualify for a plan costing between $0 and $50 a month. Families with children often qualify for even bigger discounts. The subsidy isn't alone, you never have to pay it back as long as you report your income honestly. When you apply on HealthCare.gov, the system calculates your subsidy automatically. This money is paid directly to the insurance company, so your monthly premium becomes much cheaper. There's also another benefit called cost-sharing reductions, CSR, which lowers deductibles and copays for people in the low-income bracket, but only on silver plans. This is why choosing the right plan matters. Many people qualify for discounts they don't even know about. Understanding subsidies can save you thousands of dollars a year and make healthcare finally affordable. Enrolling in an Obamacare plan is surprisingly simple once you know the steps. First, go to HealthCare.gov and create your account. You'll enter basic information such as your name, address, and identity details. Next, the system will ask for your household information, how many people live with you, whether they need insurance, and what your estimated yearly income is. Don't worry if your income changes, you can update it later. After you enter this information, the marketplace will show you the subsidies you qualify for. Then comes the comparison step. You'll see a list of plans from different companies like Blue Cross, Aetna, Molina, and Better, and more. You can filter by price, deductible, doctor networks, and coverage details. Take your time and compare. Once you choose a plan, review your details, confirm your subsidy, and finalize enrollment. After that, the insurance company will contact you directly for payment and ID cards. The entire process can take as little as 15 to 20 minutes if you have everything ready. Enrollment is not difficult. It's mainly about understanding the information. Once you complete these steps, you're officially protected and ready to use your coverage when you need it. Many people make simple mistakes during Obamacare enrollment that end up costing them money or reducing their benefits. One of the biggest mistakes is choosing a plan based only on the cheapest monthly premium without checking the deductible. A low premium doesn't always mean low cost if you have to pay thousands before coverage kicks in. Another mistake is not updating income during the year. If your income changes and you don't report it, you could lose subsidy eligibility or receive too much and face a surprise tax adjustment later. People also forget to check if their preferred doctors or medications are included in the plan they choose. Networks vary, and one plan might not cover the hospital you prefer. Some people miss the enrollment deadline and then wait an entire year with no coverage. Others think they earn too much to qualify for discounts, when in reality, even middle-income families can get financial help. Lastly, many skip silver plans, not realizing they unlock additional savings. These mistakes are easy to avoid with awareness. Taking a few minutes to compare carefully can save you hundreds or even thousands of dollars each year. While most people can only sign up for Obamacare during the open enrollment period, the special enrollment period offers a lifeline for those who experience major life changes. If something significant happens in your life, like losing a job, losing employer health coverage, moving to a new state, getting married or divorced, having a baby, or turning 26 and aging out of a parent's plan, you automatically gain access to SE. That means you don't have to wait until next year. You can apply immediately. For example, if your job ends today, you can enroll in a marketplace plan within 60 days. If you move to a new zip code or state, you qualify as well because the available plans change by location. Even major life events like adoption or gaining legal status can open the SEP window. The goal of SEP is to make sure you're never locked out of coverage during life transitions. Many people don't even know they qualify, so they stay uninsured longer than necessary. If any of these situations apply to you, you can enroll right now and get coverage within weeks. SEP ensures that life changes don't leave you unprotected. At the end of the day, health insurance isn't just paperwork forms or monthly payments, it's protection. It's peace of mind. It's knowing that no matter what happens tomorrow, you won't face it alone or unprepared. Obamacare was created to give every person in this country a chance at real health care. Not just the wealthy, not just the employed, not just the lucky, everyone. If you've ever worried about hospital bills, if you've ever hesitated to see a doctor because of the cost, if you've ever prayed you get sick because you can afford the treatment, then this is your sign to take action. Open enrollment doesn't last forever. When the window closes, it stays closed for most of the year. Don't wait for an emergency to remind you how important coverage is. Take a few minutes, visit HealthCare.gov. Compare your options and choose the plan that protects you and the people you love. And if you still have questions, drop them in the comments. I'm here to help you make the best choice. Thank you for watching. Stay informed, stay protected, and I'll see you in the next video.